everyone. Good morning. Thank you for joining us for our 4th annual Possum event. As we begin, I would like to acknowledge the traditional owners of our lands on which we meet today, the people of the Kulin Nations and any Aboriginal and Torres Strait Islanders in our midst. I'd especially like to pay my respects to Aboriginal elders past, present and emerging. They hold the memories, traditions, culture and hopes of Aboriginal Australia. My name is Jacinta. I'm a registered nurse who has had the pleasure of caring for patients at St Vincent's Hospital, Melbourne, and I will be your MC for today's event. Our annual Possum event brings together persons who have been affected by liver, pancreas, esophageal and stomach cancers. It is wonderful to see many familiar faces in the crowd, new and returning patients and their families, community support groups, members of research, allied health, medical and surgical teams. The challenges of this year have highlighted the importance of community in overcoming barriers to providing best care for patients and their families throughout their journey at St Vincent's Hospital, Melbourne. Today we are delighted to be able to connect with you virtually, a platform which has become very important in continuing therapeutic relationships and care. That being said, not without its challenges. As you navigate your way onto Zoom today, we kindly request that you keep yourselves on mute so that speakers can be heard. If you accidentally unmute yourselves, our team will be able to help out. They will also be monitoring the chat box, so please enter your questions here as we'll have a short period between each speaker for questions. Now, before I introduce our first speaker, our lovely event organisers, Lynn and Lily, have organised a door prize for the first person who logged in today. The early bird gets the worm, and Lynn and Lily, I believe our lucky winner is a big congratulations to Mr. Kenneth Bonther. So congratulations, Kenneth. We'll be posting this voucher out to you. Moving on, our first speaker, dietitian Madeline Thompson, who helps patients to maintain their nutritional well-being and maintain dietary quality of life after surgery.
Hello, sorry, just getting myself sorted. You'd think I'd have the hang of Zoom and everything by this time this year, since we've relied on this a fair bit. So I'm just getting my presentation up, and thank you very much, Jacinta, for the introduction. Okay. Sorry all. Okay, so my name's Madeline Green. Emily Thompson was the most recent dietitian, so that was a nice merger of our names. So I am quite new to the unit, and I may not have met some of you so far. So hello, and nice to sort of meet you virtually. So my name's Maddie, and I am a dietitian working in upper GI and hepatobiliary. Today I'm going to be talking about the importance of good nutrition during and after treatment. So why is good nutrition so important? Your treating team likely mentioned the importance of good nutrition at some point during your journey. If you saw a dietitian, we especially would have emphasised the importance of nutrition, since it's our whole job, essentially. So why is good nutrition important? Food is our fuel source. It provides your body with the energy to function, provides essential vitamins and minerals. It helps to improve your immune system for a decreased risk of infection. It helps for better tolerance of cancer treatments. It's essential for wound healing, helps you to maintain your muscle mass, helps to combat lethargy and fatigue, and it helps with healing post-operation. Before becoming unwell, it's really common that you might not have thought as much about what you're eating. It's often just something that we do, and during the day we often, may not give as much thought to it. You feel hungry and we eat what we have an appetite for, and this can vary day to day. During and after treatment, nutrition and eating can take on a whole new role and significance, and this can present its own challenges, and it can be really overwhelming alongside everything else that you're already dealing with. I would just like to emphasize at the start that remember, help is available. Like I said, our whole role is nutrition, and if you're feeling overwhelmed or you have specific questions about you and your nutrition, we're available. We like doing this job because we like to help people, and it is really important that you don't feel like it's just something that you've eaten your whole life, so you'll just take care of it and you can get through. Reach out if you feel like you need some help. We're more than happy to provide that, and I do have some details at the end about how to seek an appointment with a dietitian, and I'm more than happy to get to meet some more people in person. So I've mentioned all the reasons that good nutrition is important, but how do we get that good nutrition, and what is good nutrition, and what should we be trying to eat? Dietitians will often talk about this until the cows come home, so to speak. So diet variety is really important. This is because foods provide different nutrients and in different amounts. During treatment, we often do focus on energy and protein. So it is really common during your treatment, depending on what symptoms you're experiencing, that your dietitian may speak, solely about energy and protein, but nutrition and your diet does provide more than energy and protein, and different foods, as you may be aware, or I will go through in more detail, do provide different amounts of different nutrients, and all of these are important for health in different ways. It's just that during your journey, certain things can be more important at certain times, okay? For long-term health, it's also important to consider the vitamins and minerals. So that's where, when you're in the pointy end, I guess, of your treatment, you might be feeling really unwell, you might be struggling to eat and drink, which we'll talk about later. Energy and protein we do often prioritize, and it is something that we talk about a lot, but it's also important in the longer term that we consider vitamins and minerals, and those do come from a wide variety of foods. In order to get in all the vitamins and minerals that you need, what we want to try and do is to eat foods from the different food groups, and to try and eat different types of similar foods from within those food groups to help you get all the nutrients that your body needs. I'll have a little bit more of a chat about the food groups in a second, but what that means is, not just eating the same type of fruit every single day, potentially, having a banana one day and then an apple the next day and then an orange the next day, because even though they're all part of the fruit food group, they provide different amounts of different nutrients. And the same thing with your other food groups, which I'll go through now. So when we talk about diet variety and the food groups, we're talking about the 5 main food groups. I don't know, some of you might be familiar with this image. So this is from the Australian Guide to Healthy Eating, and I do have some more information about where you can find some more information on this at the end. But these are our 5 main food groups that we want to try and include day to day and week to week and month to month and year to year, to provide us with all those different nutrients that our body needs. So when we talk about energy and protein, often we spend a lot of time talking about our meat and alternative food group down the bottom here. In general, we want to try and aim for 2.5 to 3 serves of this one. Another really good source of energy and protein is our milk and alternative food group, where we want to try and aim for about 2.5 to 4 serves a day. But the other food groups, which, like I said, we may not talk about as much during the nitty-gritty of your treatment, but are important to consider down the track, are our breads and cereals, where we want to try and get 4 to 6 serves, our fruit, where we want to try and get 2 serves, and our vegetables and legumes, where we want to try and aim for 5 serves. Some days, you might get a higher amount from a certain food group, and then another day you might get a lower amount, but we just want to try and average that out overall. And like I said, it's about getting that variety from within the food groups as well. So you can see there, you know, if we look at the vegetables and legumes, there's lots of different types of vegetables in there. And we want to try and aim for a wide variety as much as possible, because different ones will provide different nutrients that are all important. So what can affect our micronutrient intake and levels? During treatment, and after your treatment, this is really important to consider, because you may have some long-term side effects and symptoms, such as feeling full early, decreased appetite, only being able to manage small portions, swallowing difficulty. You may have an impaired ability to absorb nutrients due to surgery that you may have had during treatment. So for some people, depending if you've had some kind of surgery to remove part of your gastrointestinal tract, your actual ability to absorb some of those nutrients from those foods that I just discussed might be impaired. You might need to avoid certain foods that trigger symptoms for you. What we want to try and do is to ask your GP to check your micronutrients every 6 to 12 months. And if you do find that, you know, you're really trying to get a good dietary variety, but because of some of those factors that are outside of your control, you're worried that you may not be meeting those serves that I mentioned earlier, you can discuss with your doctor or dietitian about taking a multivitamin. Okay, so we definitely recognize that there's things that are going to be outside of your control. And if you're not managing to get to the food groups, or the different serves of those food groups, it doesn't mean that you're doing anything wrong. But it is important, if you're worried that you're not getting those in despite trying, that you discuss this with somebody, because there are things that we can do to help support you to make sure that your overall health is taken care of. So it is common to experience side effects during and after treatment that can impact the amount of nutrition that you can get from your diet, even when you're trying your best. So like I said, we encourage diet variety, but we also recognize, like I was just saying, that there are things that are outside of your control, and you might be trying your best to meet those different serves, or to try and get that variety in. But there are things that can impact your ability to do that. And that can include any or all or different ones of these at different times during your treatment. So you might find that you have difficulty swallowing, you might feel full really easily, you might get diarrhea, you know, your emotions and mood may impact on certain days. It's really common that some people, you know, when they're feeling overwhelmed or you know, things are a lot. Some people get a really high appetite, and then other people find that they have a low appetite. Different stages of your treatment is going to impact your appetite in different ways. You may experience nausea and vomiting, and you know, when you do, often the last thing that you're thinking about is food. So like I said, there are things outside of your control as well. These symptoms and side effects will vary between people, and they will vary, they often vary for you during different stages of your treatment as well. It's really important to speak to your treating team and a dietitian one-on-one to discuss your individual circumstances. And as I mentioned, these are often out of our control, but it is also important to try and identify what you think is having the biggest impact on your ability to eat and drink in the way that you're trying to, because that means that we can really tailor some strategies to try and help you overcome those symptoms and side effects. Or, you know, if it is something that we're not able to do that for, to do something like recommending a micro or a multivitamin or nutrition supplementation to help make sure that, you know, those symptoms and side effects don't have a negative impact overall. So some of these nutrition issues, and I'll just give an idea of some of the strategies that you might be able to use for some of the common side effects and symptoms. But like I said, for any individual advice, it's really important that you speak to your treating team, and you can request to see a dietitian so that we can discuss your individual circumstances. So if you're feeling full really easily, you're experiencing a poor appetite, or you might have nausea and vomiting, some things that can assist with this include eating by the clock. So setting yourself some set times, and even if you're not getting those hunger cues or appetite going, okay, it's 10 a.m, it's time for a morning tea snack, and then getting to what you know is lunchtime and going, it's lunchtime, it's time for a snack, even if you're not getting, you know, those stomach grumbles that you normally would during the day. Trying to eat smaller, more frequent meals. So aiming for 6 to 8 per day can help. They're easier to sort of sit down and manage. You can get more nutrition in over the day, and it can be less overwhelming because it is really stressful when you know that you need to eat. Your treating team or your dietitian is emphasizing the importance, and you're going, yep, okay, you know, I really know that I need to, but you're sitting down, the meal's in front of you, and all your sort of senses are saying, no, I don't want to. So trying for smaller, more frequent meals can be a good way to make that less overwhelming and less challenging for you. We want to try and prioritize nourishing foods. So we want to, you know, get the most out of each mouthful that you put in, so you get as much nutrition as possible. Try and aim for nutritious snacks in between meals. We want to try and have our drinks 30 minutes or more from meals to allow you to eat as much as possible during meal times and to minimize symptoms that you might experience. Nutrition supplement drinks like Fortisip or Sustagen can be really helpful for getting in extra nutrition, and or, as I mentioned before, with the diet variety, a micronutrient or a multivitamin supplement, just so that some of those smaller nutrients are taken care of as well if you're not able to get in the variety. And if you're experiencing nausea and vomiting, we want to try and eat when you're feeling well. So if you have a certain time of the day, you know, you feel more nauseous in the afternoon, really making the most of the morning and trying to get in as much food as possible there. And also just trying to eat regularly. I know that often when you're feeling nauseous or you're vomiting, you don't feel like eating, but sometimes, you know, the emptier your stomach is, it can actually exacerbate those symptoms. So just trying to eat regularly to try and minimize that as well. If you're experiencing diarrhea, so if diarrhea occurs 15 to 30 minutes after eating and with quite a lot of urgency, you might be experiencing dumping syndrome. This can also occur 1 to 4 hours after eating, and it's caused by food moving too quickly into your small bowel. And this can be a side effect of having certain surgeries to resect certain parts of your gastrointestinal tract. Other symptoms of this can include nausea and vomiting, bloating, cramping, sweatiness or shakiness, fullness, and a lack of concentration or tiredness. To help prevent and manage these symptoms, we want to try and drink plenty of liquids between meals. Avoid sugary foods and drinks like cordial, soft drink, mixed alcoholic drinks and lollies because they can really exacerbate and cause those symptoms. Try and include some high fiber foods such as lentils, baked beans, whole grain breads and cereals, and skins of fruit and vegetables, as long as that's something that your surgeon has said is okay, depending on how far away from your procedure you are. You may want to trial a fiber supplement. Before introducing that, I would really encourage you to discuss it with your doctor and or dietitian before starting to make sure that, that's something that's appropriate for you and is done in a way that doesn't cause other symptoms. Some starchy snacks can help, like bananas, oatmeal biscuits, or a slice of bread. Sorry, I flicked to that next slide a little bit quickly. So another symptom or another common nutrition issue that people may experience is malabsorption. Symptoms of this can include if you're, feeling like you're eating and drinking quite well, but you're losing weight or you're having difficulty gaining weight. Another really common symptom is having loose, pale or fatty bowel motions that may be quite difficult to flush. And that's, particularly if you've noticed a difference or your bowel motions have changed, it's really important to discuss this with your doctor or dietitian. I know that, beforehand, it's one of those things that we don't spend a lot of time talking about, and then all of a sudden we'll be asking about your bowels a lot. But it is really important because it can let us know if there is something like malabsorption occurring. So do discuss with your doctor or dietitian if you notice any symptoms. If you are experiencing malabsorption, it is really important to ask your doctor to check your vitamin and mineral levels regularly. And you may need special enzyme capsules to help break down and absorb food. For example, Creon, which some of you might be familiar with. And this is another one that it is really important that you don't just sort of feel embarrassed to discuss your bowels, or feel like, oh, maybe they'll get better, or, try and change your intake, or just suffer in silence, do make sure that you reach out, particularly if you notice any differences, because there are things that we can do to help with that and to counteract those symptoms. If you're experiencing reflux or difficulty swallowing, for reflux, we want to try and remain upright while eating and for at least 30 minutes after your meals. Want to try and avoid foods that make your reflux worse, and to eat food slowly and chew it really thoroughly. If you're having difficulty swallowing, we want to try and choose softer food options and nourishing fluids. Include protein options with each meal, and a nice soft protein option that's easier for you to swallow. And nutrition supplement drinks, again, are a really easy way to get in extra nutrition, and are often, because they're liquid, easier to tolerate if you're having difficulty with your swallow. Again, discuss with your doctor or dietitian for advice, or if you notice any new symptoms. If you're trying to regain weight that you may have lost, again, we really want to try and focus on energy and protein intake and making every mouthful count. We want to try and aim to have small, frequent meals and snacks. So again, 6 to 8 small meals. We want to try and include energy or calorie dense foods. So these ones are really important for getting in enough energy overall for your weight. And then we want to try and include protein at each meal, because protein is the one that's keen for helping to regain the right kind of weight, so your muscles. Nutrition supplement drinks and nourishing fluids are an easy way to help get in extra energy and extra protein. And the other thing that's really important is that you're using that protein to feed your muscles, but then you're also using your muscles to help build up your muscle mass. So physical activity to build muscle, especially resistance training, is really helpful. And for individualized advice on that, it's really important to speak to a physiotherapist or exercise physiologist, and to also discuss with your doctor as well, depending how far away from your treatment you are, if they think that that's appropriate for you to start engaging in again. So just quickly, a high energy and protein diet. So high energy foods, these include things like avocado, oil, butter, and salad dressing, peanut butter, nuts, muesli bars, and dried fruit, cheese, cream, full cream dairy, and custard. And our high protein foods include things like meat, chicken, fish, eggs, nuts, and seeds, milk and other dairy products such as cheese and yogurt, beans, legumes, and lentils. And again, the nutrition supplement drinks, which are a really good source of both. I also just quickly wanted to touch on alternative diets. Like I said at the start, we know that it can be really overwhelming and that you're going through a lot during your diagnosis and treatment. And often, there are things out there that we understand that you're going to be looking for things to help during this time. But it's really important if you're coming across any sort of information about particularly nutrition that's coming from somewhere other than an accredited practicing dietitian, that we're considering the safety and effectiveness of the diet. Many of these alternative diets do cut out whole food groups. So for example, dairy or meat. And like I've just spoken about, these are really important for energy and protein. And energy and protein is really important during treatment. They can make you feel even more tired and weak and can affect your immune system. Mega doses of some nutrients can be toxic. So some of these diets may include really high amounts of some nutrients, which particularly with certain medications that you're taking and during certain times of your treatment can actually be a bad thing. And currently there's no scientific evidence to support any alternative diet or that any special diet can help control or cure cancer. And as I touched on earlier, what we really want to focus on is by eating well, by having a variety of foods every day, because each of these foods and each of these food groups have a different role, and each of those is really important. And that if you're struggling to get that variety in, that you reach out for assistance, because a dietitian can provide you with some really specialized and targeted strategies to help with that. So in summary, if you're having trouble eating enough, are losing weight or are underweight or trying to gain weight, we really want to try and prioritize energy and protein. Where possible, we want to try to avoid foods that trigger symptoms like reflux, nausea, vomiting, and diarrhea. As much as possible, we want to try and aim for a wide variety of foods from all 5 food groups and different types of foods from within each group. We want to try and aim for adequate fluid intake, so at least 1.5 to 2 litres per day. And just remember that what you should eat and what you find you can eat are often different, and sometimes this is out of your control. Speak to a dietitian about how to optimize your diet.
I'm listening.
Speak to a dietitian about how to optimize your diet and strategies that we can put in place for you if you're having trouble. And if you do want some further information, some great sources include the Australian Guide to Healthy Eating, which was that pie chart I showed you earlier with the different food groups. The Cancer Council has some great information as well, and these are some pictures of 2 different booklets that are available. So if you would like a copy of either of those, feel free to get in contact with me and I can provide it to you. And also your friendly local dietitian is always happy to help. We like doing this job because we do like helping people and we do like talking about nutrition. So please do always feel comfortable to reach out if you want to have a chat. For further dietetic input, if you do want to speak to your friendly local dietitian, we do recommend that you ask to see a dietitian if you experience any of those symptoms that are really impacting your ability to eat and drink, or if you have any questions about your nutrition. And sometimes this can come up towards the end of your treatment. Like I said, you spend so long focusing on energy and protein and small frequent meals, and then you might get a little bit further away from those symptoms having as much impact on you, and you might have a few questions about where to from here and what a good diet looks like, and we're more than happy to discuss that as well. You can see a dietitian at the St Vincent's Outpatient Clinic, a community health dietitian in your local area, or a private dietitian in your local area. Your surgeon or GP can refer you, or you can self-refer. And I'm more than happy, like I said, for you to get referred in and for me to meet a few more people face-to-face in the outpatient clinic here. Thank you. Any questions?
Thank you very much, Madeline. I don't think we've had any questions pop up in our chat box, but I thought we might have 1 minute just for a quick question. I know that Christmas is coming up, so how can we maintain good eating behaviours with so much temptation?
Yeah, and that's a really good question, and it is, you know, something that I did want to touch on earlier before as well, that we spend so much time talking about good nutrition, and it is really important to remember that the actual method of getting in your nutrition is eating and drinking, and that is really important for, you know, us having our social connections and human interaction, and probably something that we really, really felt this year when we weren't able to go out to eat and drink. And we really want you to be able to participate in those events as well, and to get together with your friends and family and to have those really nice social times, particularly when you have, you know, been through so much. It's really important to do that. I think it's just also really important to, you know, balance that. And when you say, you know, temptation, it's just important to remember you and what's important for you, and symptoms and side effects that you may experience, and that, you know, you're probably not going to have a fun time if you're having to rush away from the Christmas table because you're, you know, suddenly experiencing nausea or vomiting or any of those other symptoms. And to just remember that you know, the things that can impact you individually, and to try and keep that in your mind, and to put some strategies in place beforehand. I think sometimes some forward planning and thinking about things and whether you might need to take some of your own snacks or drinks, communicate with people as well. If you're not hosting the event, it's really important that you communicate your dietary needs, and that people are always, you know, sometimes you can feel a little bit awkward in doing that, or you feel like you might be a burden, but people are always really happy to help and to do those things for you. So also reaching out to people to get them or to let them know, you know, the specifics of some things that you might need on the menu, bringing along some of your own snacks, and also just remembering that what's healthy for you right now may not be the same as what's healthy for other people, and keeping that in mind. Again, I think I've said it about 50 times during that presentation, but if you need some help with some ideas for some ways that you can still participate in those social events, but looking after yourself and your health as well, you're more than welcome to get in contact.
Excellent. Thank you so much, Madeline, for answering that question there. We are going to move on. We're getting a little bit pressed for time. So our next speaker is Kelsey Bland. So Kelsey is an exercise physiologist. And when I first heard about physiologists. So we just got a bit of an echo here. I think you might just have to turn it down completely. Okay. All right, well, there we are. I was curious about their role in healthcare. Now, exercise physiologists prescribe exercise. Unfortunately, you cannot get this in a pill. However, I'm very excited to welcome Kelsey Bland to provide us with tips on how to target exercise fatigue.
Candidate at the Australian Catholic University Mary MacKillop Institute for Health Research. And today I'll be talking about exercise after cancer, the why, what, and how. So first I'll cover the why, which is the impact of exercise on cancer and what we know from the best available research evidence to date. Next, I'll move on to the what, including the current exercise guidelines for people who have been diagnosed with cancer. And lastly, the how on becoming more active after a cancer diagnosis and during or after cancer treatment. So first, it's important to recognize that we know exercise is safe for people with cancer, and this includes both during and after cancer therapies, including chemotherapy and radiotherapy. We also have evidence supporting that exercise is safe for people with early stage cancer, but also more advanced or even terminal stages of the disease. We also know that exercise is safe across a variety of different cancer types. Now, the impact of exercise on cancer is wide-ranging, and there are numerous physical and psychosocial benefits of exercise both during and after cancer treatment. Some of the benefits include lower or improved cancer-related fatigue, lower levels of anxiety and depression, improved overall quality of life, and significant improvements or at least a maintenance in our physical function and fitness, including muscle strength and cardiovascular fitness. There's also some evidence suggesting that exercise can potentially improve our bone health after a cancer diagnosis and even sleep. Interestingly, we also have some emerging evidence showing that exercise can improve treatment completion rates. So this includes our ability to adhere to cancer treatments, including chemotherapy, or our ability to tolerate cancer treatments. We also know that there is an association between higher levels of physical activity after being diagnosed with cancer and prolonged survival and even a reduced risk of disease progression or cancer recurrence. But when I say exercise, what are we talking about? Since a variety of different activities could be counted as exercise. Well, there are two main forms of exercise that we often discuss when prescribing exercise to people with cancer. The first and probably more familiar form of exercise is called aerobic exercise or cardio. This type of exercise is often continuous exercise that increases your heart rate and breathing. Some examples of aerobic exercise include walking, cycling, swimming, or perhaps running or jogging, even dancing. And it tends to be exercise that we perform for longer than 10 minutes at a time, but often longer and even up to an hour or more. Strength or resistance exercise training tends to be less common or popular among the general population and people with cancer, but it's equally as important, and it includes specific exercise that is weight loading or weight bearing in order to improve our muscle strength. Examples of resistance exercise training include exercises for our upper and lower body that might use body weight as resistance, or could include machines, dumbbells or free weights, or elastic bands. Often this type of exercise is performed at a fitness center or gym, but it can also be easily performed on your own at home or outside using minimal amounts of equipment. Some forms of Pilates and yoga and other types of exercise may be able to improve muscle strength, but not all types. As I mentioned, trying to incorporate a combination of both aerobic and resistance exercise training is ideal, but it also may not be the best starting point either. And you just need to start at a pace that you're comfortable at and with exercise that you're comfortable at. And we'll talk a bit more how to do this later on. So how much aerobic and resistance exercise training is recommended for people who've been diagnosed with cancer, and how much do we need to do in order to experience some of those benefits we just talked about? At the moment, the best available research evidence suggests that we should be doing at least 3 days per week of 30 minutes of aerobic exercise at a moderate intensity. A moderate intensity means that you can still carry on a conversation as you're exercising, but you may not be able to sing if you were asked to. Also, at a moderate level of intensity, you might notice that your heart rate and breathing increase, and that's a perfectly normal response to the exercise. Strength training is recommended at 2 to 3 times per week, and using a combination of upper and lower body exercises performed maybe 2 to 3 sets of 10 repetitions each. It's also recommended to be performed at a moderate to vigorous level of exercise intensity, and that's a level of an intensity where your muscles may feel a bit tired after your exercise session. Now, I fully understand that these guidelines can seem overwhelming, especially if you haven't been active for a while or you're not used to exercising. So this may be a goal for the future, but it may not be your starting point. So as I mentioned, if you haven't been active for a while or you're not used to exercising, here's how you can maybe get started. The first advice is to just be as active as your physical abilities allow. Start slowly, then add a little more as you feel you can. It's important to always listen to your body, especially if you are going through cancer treatment. We do need to be able to adapt to the current circumstance that we are in, and for many people with cancer, you may feel like you have some good days and bad days. On bad days, when maybe you're feeling a bit more fatigued, or you haven't had a good night's sleep, or maybe you have other symptoms and side effects that just make it difficult to do a little bit more, go easy on yourself and don't do as much on those days. But on the days where you might be feeling a little bit better, see those days as opportunities to add more or progress your exercise routine. Take advantage of those days to maybe try and push yourself a little bit harder if you feel you can. Lastly, focus on the exercise that you enjoy doing. If you do love going to the gym and lifting weights, that's amazing. If you don't, that's also okay. If you prefer to exercise outside with others or walking your dog, maybe you prefer sports or online dance classes at the moment, that is fine as well. Do what you enjoy doing and you feel that you will do more of. It doesn't need to be a chore. The most important message is doing something, even just a few minutes, is better than nothing at all. If the exercise guidelines I spoke about previously do seem overwhelming, adding a few minutes can still actually have a benefit, and it can help you go in the right direction of adding a little more activity to your regular routine. If you do want a little more structure and want a little more advice and professional guidance about both aerobic and resistance exercise training and how you can fit that into your life, we do highly recommend that you see an exercise professional, including either an exercise physiologist or AEP, or a physiotherapist. If you don't know what an AEP is, they are an allied health professional with a 4-year bachelor's degree or more, and they're trained to use exercise as medicine to help with chronic disease management, including a cancer diagnosis, to improve your overall health and well-being. A physiotherapist also has at minimum a 4-year bachelor degree or higher, and they have specialization in physical rehabilitation and the prevention and treatment of injuries, and they use a variety of different techniques, including exercise, but also massage and joint manipulation to treat their patients. If you have any injuries or physical limitations that are preventing you from being more active, it may be best to work with a physiotherapist to help get you on the right foot. If you're interested in seeing either an AEP or a physiotherapist, talk to your doctor about getting a referral. You can also visit essa.org.au/findaep or choose.physio/findaphysio to find either an AEP or physio who may be in your area and who specializes in cancer care. Also, it's important to know that you are eligible if you have a current cancer diagnosis for 5 free consultations under the Medicare Chronic Disease Management Plan. So this is an excellent way to get specific, individually tailored advice and guidance about exercise and to help you perhaps develop some strategies to be more active or bump up your level of activity in your current circumstance. Well, that concludes my presentation for today. I appreciate you joining in, and I'm happy to answer any questions or listen to your comments on this topic.
Thank you very much, Kelsey. Just as a friendly reminder to everybody, we will be able to provide this presentation to you after we have finished today, so you will be able to look up any of the resources. Now, I do believe we have Kelsey here for a quick question. So Kelsey, I just wanted to ask you, can you give us a brief overview of exercises that we can do from home without equipment?
Yeah, so when it does come to resistance training, it can be more challenging to find exercises to do at home, but there are still quite a few that you can do. And actually, I do recommend looking at the Cancer Council booklet that is available at all cancer treatment centers that has sort of a list of some basic exercises that you can follow along with and do at home. One thing I thought I would mention is that elastic bands or resistance bands are really light, really portable, easy to store at home. And there are lots of different things that you can do with just 1 or 2 bands to strengthen both your upper and lower body at home. And I would also recommend sort of talking to maybe a physical therapist or exercise physiologist about some exercises that you can do with this band. But there are also, even if you just look up resistance band exercises at online, you'll be able to find lots of different simple exercises. One really fundamental exercise, though, that anyone can do at home on your own is a sit to stand or a squat. Being able to get in and out of a chair is often something we take for granted when we can do it, but something that can really impact our quality of life when we lose that ability. So even just with a chair at home, you can place your feet sort of flat on the ground, cross your hands over your collarbones, or hold onto the armrest for some support, and you can practice standing up and down. If that feels too easy on its own, you can try holding something heavy in your hand. It could be like even a jug of milk or some cans of beans if you don't have anything else. And you can practice adding it with a bit of weight. You can also progress to a squat where you don't actually use a chair and you just lower or bend your knees and straighten your knees. And this is a really important way to just maintain or build our leg strength. Some upper body exercises that you can do at home also include things like push-ups. If a full push-up feels too difficult to do, you can actually do a push-up against a wall to maintain and target your upper body muscle strength. Or you can do modified versions.
Kelsey, we might just have to cut that one short there, but thank you very much for those tips.
No, that's it. I was going to end there anyway.
On the chair, the squatting and the push-ups that can be adjusted depending on your strength. We are now going to move on to hepatobiliary surgeon, Mr. Adrian Fox, who will talk to you about the important questions to ask your doctor after you have finished treatment.
Thank you very much. Lynn, just give me a thumbs up if you can hear me talking. Oh, there we go. Great. I'll just share my screen. As I'm doing that, I'd like to say thanks to Lynn and Michael and the whole organising team for the invitation to speak. So thank you very much. As stated, I'm Adrian Fox. I'm a liver and pancreas surgeon here at St Vincent's, and I've been given the topic of what questions to ask your doctor when you've finished treatment. So in one slide, I've put together my list of what I think would be important questions to ask. Now, this list is mainly directed to patients that have had a cancer diagnosis in the past, but also some things do apply to other people. But this list is really about cancer problems. And these are the questions that often, when I talk to patients and they seem to have an understanding of what they're up against, they'll ask these sort of questions. And so these, I'm just going to run through a few of them. Based on my cancer stage and my response to treatment so far, what is my chance of my cancer? What is the chance of my cancer coming back? If my cancer does come back, what is the likelihood of curing it with further treatment? What, if anything, at this stage can I do to improve those chances? And that would obviously involve chemotherapy or other treatments. What should I look out for? And that's in particular, what symptoms should I look out for that may be a sign that my cancer is coming back? How often should I be having checkups, scans and blood tests and so on? And what treatment-related symptoms should I look out for and how should I manage those? So, and that's not really related to the problem of your cancer returning, but if you've had a Whipple resection, for instance, that's reconfigured your upper gastrointestinal tract and you might have different symptoms when eating. And what symptoms would we be interested in, because we can often modify those and help you. What would be the limitations on getting back to near normal activities? For instance, when can I get back to surfing? And people have a lot of different activities and every person's a bit different. So these are my questions that I think are important, but out of these questions, there's one in particular that I think is specifically important. And it may not be important necessarily to the patient at the time, but it really guides their treatment. And this question is, if my cancer does come back, what's the likelihood of curing it with further treatment? And that's a very important question because the tumours that we deal with around the liver, the pancreas and the stomach and esophagus are all very different animals. These tumours respond differently to surgical resection. They respond very differently to the different types of chemotherapy that we use, and they are very different diseases. And so I'd just like to, I'm not going to try and summarise every tumour that we talk about, but there are a few interesting points that I think highlight a few of these points. In particular, pancreas cancer. And so I'll just touch on that for just quickly. And there's a couple of numbers that are really significant in my mind. 14% and 25%. The 14%, when I first started doing pancreas surgery, when I first started training in that was almost 15 years ago. And 14% was the life expectancy of a patient having a resection for pancreas cancer 5 years later. And that was a pretty awful diagnosis, especially you've had the surgery. These are patients that have had surgery. That number now is 25%, and that's due to advances in chemotherapy, some advances in the surgery, and also in the patient selection, in selecting those patients that we think are going to benefit from having an operation. Liver cancer or hepatoma, some patients might be listening today that have had this diagnosis, and this is a totally different animal, otherwise known as hepatocellular carcinoma, and this has a number that sits in my mind of 75%. And that 75% describes a different scenario. Patients that have a hepatoma and have it removed have a 75% chance of the tumour coming back. That doesn't sound great, but when the tumour does come back, we can remove the next tumour. We can burn it, we can zap it with radiotherapy, we can block off its blood supply, we can treat it. We can also submit these patients to liver transplantation. And an interesting fact that I came across when I was doing training in liver transplantation, that was over 10 years ago, is that when we would, I remember one time we were taking a fairly healthy 70-year-old's patient's liver out as a donor, and this poor patient had some major catastrophic medical problem, and their family had, they were probably on the organ donation list and they were donating their organs. And we were going to take a 70-year-old's patient's liver and then transplant it into a 10-year-old person's body. And so I thought that 10-year-old would probably be getting shortchanged on a liver that already had 70 years worth of mileage on it. But the interesting fact that I came across was that the average liver, if it's not diseased with hepatitis or irritated by constant alcohol, would have a life expectancy of 150 years. And so I thought that was an inspiring and interesting fact. Colon cancer that's spread to the liver these days has become a chronic problem, a chronic disease. Not a chronic problem, but it's not something that people die of immediately, because the chemotherapy has improved so much that most patients that have spread of their colon or their bowel cancer can expect to live for 2 years just on chemotherapy alone, even if they're not suitable to have an operation. If they are lucky and they've only got one spot of tumour in the liver, and so there's no other tumour that's spread anywhere else that we can see on today's sort of sophisticated imaging modalities, that we know that we can remove that one spot, even though this is tumour that has spread, we can remove that one spot, and these patients will be alive 75% of the time 5 years from now, and that's often without chemotherapy. That's just having that spot removed with surgery. So if the cancer comes back, it's different for the different tumours that we treat. And so as I said, these are different animals and they're treated and handled differently. And so does it matter how often I have scans and how often I have post-treatment surveillance? And by that I mean scans and blood tests and cancer markers. And there's a different mentality depending on the tumour that we're dealing with. And so the different sort of treatment modality would be, the different idea would be to either pick it up early and get rid of it, or worry about it if and when it comes back, because the treatments would not be necessarily aiming to cure and eradicate the tumour. So that sort of gives you a history of where we've sort of come from and where we're heading. But certainly in the future, and some people listening to this talk today would have been involved in some of these newer studies that we're examining the benefit of circulating tumour DNA. And so circulating tumour DNA are small snippets of DNA in the bloodstream, in patients' bloodstream, and these are little mutated areas that the mutation only appears in the cancer. And so we can find those mutations sometimes, if the patient does have a cancer, floating around in the bloodstream, and it's like a fingerprint of the cancer floating around in the bloodstream. And so this is very exciting information to know, but how we're going to use it in clinical practice is the challenge, and how it's going to change things. I'm sure it will change things significantly, but as I was saying, each tumour is a little bit different. And I've pulled out here a recent study regarding gastric cancer, and here's a slide demonstrating how this can be used. And if we look at this graph and zoom in on it, you can see over here on the left of the screen, but the before surgery graph demonstrating that in this patient in particular, that they could find this tumour fingerprint in the bloodstream before they had an operation. And then, as you would hopefully sort of expect, after they have their cancer removed with surgery, it drops to zero and it's no longer seen, which would be encouraging. But then in this patient, you can see post-operative day 127. So here, this patient's probably having some chemotherapy after their resection, or maybe they're not. And we find the fingerprint in the bloodstream again of these circulating mutated DNA sequences. What to do about that is the question, and whether that person should have double the dose of chemotherapy or move on to a different one, and what that means for their long-term survival, it's still under investigation. And I'll just go back to this. Pancreas cancer gets a bad rap, and mainly because pancreas cancer is an awful disease, but also very stubborn to treat. There's a recent paper that shows that, maybe only 40% of patients before their pancreas cancer resection are actually found to have these mutated snippets in their bloodstream of the little signature that they've got the tumour there. But if they do have it beforehand, then you operate on these patients, they nearly always recur afterwards. If they don't have the tumour mutated DNA found in the bloodstream preoperatively, those patients, some of those will not have a cancer recurrence. And that's some of the early work that's been published just recently. Interesting area, and it probably will change how things are managed in the future. My last slide I'd like to end with is a slide by this is a slide I found when I was researching this talk, a couple of Brisbane academics here from Australia, and we're quite proud to see that a few Brisbane people have been published in Nature, and Nature is one of the premier medical journals in the world. And in order to have your work published in Nature, it needs to be fairly high quality. This was a couple of psychologists looking at whether people that have on optimism, pessimism, psychological scores when they're tested, whether pessimistic people die earlier than optimistic people. And basically what they've shown is that pessimism is associated with dying earlier. But however, optimism, just because you're an optimistic person, doesn't mean that you're going to live longer than the average person. So my concluding remark is that you should be optimistic because it's not going to hurt you. So thanks very much.
Thank you very much, Adrian. That was a wonderful talk, and particularly interesting to learn about the life expectancy of the liver and the circulating DNA of the tumour. Just a quick reminder, does anyone have any questions? If you do have questions for Adrian, could you please pop them in the chat box now? Will give us a few moments for that before we move on to our next speaker.
It looks like I'm in the clear.
Excellent. All right, we might move on then. Thank you so much, Adrian. Managing your feelings about a cancer diagnosis and treatment can be difficult, often causing stress for patients and their loved ones. We have the Medical Director for Psychosocial Cancer Care, Dr. Justin Dwyer, to talk about how to cope with these emotions and fears.
Thank you very much. Can you all hear me okay? I think I've pressed all the right buttons on my computer, but always good. Okay, great. So thanks for the intro. And it was really interesting listening to Adrian's concluding remarks about the place of emotion in terms of how people go with their cancer and their survival. Because I think, it's one of the sort of enduring things that we notice, that people feel profoundly changed usually by a cancer diagnosis. And one of the really big things that people are often confronted with is, how do you go forward in your life feeling as though there is meaning and purpose? How do you go forward feeling like you are the same person you were before when you feel so changed in your body? And I guess, what I might do is sort of talk about the emotional experience of being diagnosed. And I say that from the perspective of being a psychiatrist. No doubt people amongst us who've been diagnosed will have a much richer awareness of what that is like. So I do apologise if I come across as sort of teaching you guys to suck eggs. But I'll talk about the experience of the cancer from a sort of more universal perspective, and then also talk a bit to about the experience of going through something like that surgery, and talk about the things that sort of make a difference. So for most people, when they are diagnosed with cancer, it is an experience that usually leaves people feeling completely changed as a person, then and there in that minute. And most people that I talk to would tell me that when they hear those words come out the mouth of their doctor, that there is this inward sense of shock and often shutting down. And it's often very difficult to sort of retain any information after you've heard that word. It was interesting before to see the list of questions that Adrian had that he would suggest asking. And I guess what I would sort of add to that is in those early, well, in any important conversations you're having really, giving your doctor a list of your written down questions and then using your phone to record the doctor answering those questions, I think is a really vitally important way of feeling as though you've got some hold on the information as it comes in. And often with that experience of shock at initial diagnosis, there is a change people go through where there is, number one, this feeling that you have now become a cancer patient, that your identity is different now in some way, and that as you go forward in life, you'll always carry with you that change in how you sort of see yourself. The second often is for people that when they get the diagnosis, the future almost instantly vanishes. You know, I'm sure if we were all to talk about how we see the next 5 years of our life, we would have some story in our minds about what we're going to do. We're going to travel, changes in family, hopefully with, you know, Victoria opening up, you know, heading down to the beach and all those sorts of things. But when you get a diagnosis of cancer, that capacity to see the future often disappears, only to be replaced with a series of tests, investigations, appointments, staging scans, admissions for surgery, pre-admission, those sorts of things. It's almost as though your future now is sort of determined by the intervals between the different tests. And then the other big thing that people commonly report is that there is a sense of being quite suddenly cut off from people, of feeling as though you can't really tell people what it's like, how you feel. A, because it's impossible to, I think, to communicate properly. But B, because often when people, you know, ask you how you're doing when you've got a diagnosis of cancer, a lot of the time, often what they seem to want to hear is that you're doing okay, you know, you're doing fine, you're staying positive, you're fighting the fight. And I think, you know, the result of that often is that people do find themselves feeling quite alone with how they actually feel, their despair, their grief, their feelings of anger, also to the good things that come along with it, the changes in perspective about how you might see your role, your relationships, yourself. And there often is a feeling that, you know, the only acceptable response to how you're going is I'm having treatment, you know, I'm doing good, I'm going to get through this. So those three big things, number one, the feeling of being changed. Number two, the sense of the future being very different. And number three, the sense of not really being able to communicate as openly as you might want to your family members and to your loved ones, can I think be profoundly unsettling for people. And often it's really only when, you know, you get to sort of treatment planning and starting treatment that people start to report that they, you know, they feel a bit more like their normal selves. They're able to plan things now. They're able to, you know, decide what they might be doing in 2 months' time, 3 months' time, 4 months' time. But then you add to that something like the experience of a Whipple procedure, which I think is, certainly my experience seeing people going through it, a very psychologically challenging experience for people. It really can sort of draw out that process, I think, of feeling psychologically recovered. And I guess, you know, when we sort of talk about, you know, the role of emotion, look, I think there is a myth that you have to be positive. There is a myth that you have to be able to say to people, you know, I'm not letting it get me down. I'm not letting it get to me. you know, I'm pushing on, I'm going to fight, I'm going to get through this. And with that, there's a worry that if you feel any different, if you feel upset or distressed or depressed or demoralized or frustrated, that somehow that equates with giving in to the illness, that somehow that equates with not doing your bit for getting through it. And look, I'm going to download that paper and have a look at it. I haven't seen it before. It's a very interesting thing that sort of Adrian's mentioned, but you know, I do think it is a myth that you have to stay positive. I think it is absolutely impossible to go through something like this without all the completely natural feelings of frustration and anguish and grief, the sort of shared moments within couples of feeling, you know, that things are changed. You know, I think all of those things are totally normal and need to be respected and acknowledged. And I think, you know, are actually okay to be talked about. I guess, you know, the team that I work in, you know, we would see a lot of people who emotionally are finding it very difficult to manage their cancer, and often are in a position of feeling like their feelings, their emotions now have become an additional problem for them. And look, I guess for us, you know, the things that we would be sort of looking out for that might make us worry about someone's emotional response, you know, would be things like, you know, number one, losing the capacity to enjoy anything really. So normally, although people can feel very sort of frustrated and upset and despairing, you know, they're still also able to experience joy, to feel connected to family, to feel interest in things, you know, to feel as though there are parts of them that are very connected, and feel alive. And I think when you lose that capacity to enjoy things, that would be a point at which we would probably wonder about some talking or some additional support. Often too, you know, and particularly seeing people going through really grueling procedures like the Whipple, there are lots of moments where people do feel as though they are defeated by it and that they have nothing left to give in terms of going on with their recovery. It's not uncommon for us to sort of see people in those moments who might say things or think things like, you know, anything would be better than this. If I could go to sleep at night and die and not wake up, that would be a great solution. I think it's not uncommon for people to have those thoughts as they go through something as grueling as a recovery from surgery like that. And again, I think that's actually, you know, quite a okay thought to have, because it's about trying to solve a problem and find a solution to something that doesn't feel it can be sorted any other way. For us, when we would worry is when that becomes more, you know, I actually want to die, I want to take steps to end my life, as opposed to, I just want things to be different and I want relief from my suffering. I think too that, you know, that there are lots of things in terms of the emotional experience of recovering from something like Whipple procedure, which are really important. You know, often it is the little moments in the day, I think, that sort of make people feel much, you know, can push it either way. You know, something like a comment from, you know, a member of staff that might, you know, not be said in a sort of unhelpful way, but comes off as a bit dismissive or not really acknowledging of how someone's really feeling, can, you know, make people feel quite down. And ultimately things like, you know, the nurses coming in and talking with you about your interest in motorbikes or that kind of thing can make a big difference and turn people around. So staying connected to what is important for you and having that as a key part of your care, I think, is absolutely essential in terms of managing the sort of emotional process of getting through an illness like cancer, and certainly something with a long recovery like a Whipple's procedure. I think, you know, most people actually come through it feeling quite changed, as in they feel as though they've gone through a process of personal change that alters what seems to have priorities in their life and how they will find meaning and purpose. And often that can be one of the positive things to sort of come out of it. So not all of the emotional changes of a diagnosis of cancer and the treatment are things that necessarily need to be worried about. I guess, you know, it is one of those things, of course, that is, you know, entirely individual. And one of the big things that we would always try and do with people is to find a way to make sure that that individuality is there as much as it can be all the way through treatment. I think things like, you know, talking with staff about, you know, what is really important to you as a person, putting that into a document, which can be part of your medical record, I think is vitally important. It's always very helpful, I think, for sort of staff to know what it is about you that makes you who you are and what makes you tick. And sometimes, for example, when you're in hospital, bringing things in that are part of that can really help people feel emotionally gathered. So sort of a good example of something like that would be, you know, we had somebody who went through quite a complicated recovery from a Whipple's procedure. And one of the big things that made a difference was the family bringing in photographs of that person from when they were younger and when they were well and when they were doing things like traveling the world, fixing their car, you know, cooking, you know, bouncing the grandkids on the knees, those sorts of things. Those photos made the biggest difference to this individual because all of a sudden the conversations that they were having weren't entirely focused on things like how your bowel's going, have you eaten, did you sleep last night, have you been to the loo yet? All of the conversation started to have this sort of edge to it that was about being well and being healthy and being out there in the world living your life. And it really made a big difference. It doesn't sound like a big thing, but actually the impact of it was consistent across all the staff, day, night, all the different allied health staff that were in there, and gave the doctors as well some sort of points of conversation that took the focus away from it all just being about cancer. Sorry,
Thank you so much, Justin. That was really, really informative. We really appreciate you attending today. Just a quick question for you. What resources are available for patients, their families and friends, perhaps that we could find online?
So I think that the Cancer Council of Victoria has a few very good resources, and they also have access to support groups. So for example, you know, you might be there alongside your husband or your wife or your dad who's, you know, dealing with their cancer. And, you know, the Cancer Council of Victoria has access to, where is it a good place to go to find links with, for example, groups and support networks who've already been through this, who can be so helpful in terms of the little practical things that make a difference, but also too, you know, connecting with people in a way that just normalizes what you're going through. So I think that's a really, really helpful resource to have. The second would be if there's sort of more discussion that needs to occur one-on-one, something like a mental health care plan through your GP. Your GP is able to, you know, in discussion with you, make a referral to a psychologist that will allow you to access under this Medicare scheme, you know, 10 sessions or so of psychological input. You get most of it back from Medicare if the plan comes from a GP. And I think just having someone where you can go along and you can say whatever you want, however it is you're feeling, whatever it is you're thinking, and you don't have to worry that you're going to burden or stress out the other person, or that, you know, they're not here to talk about that. You know, I think that kind of thing can be enormously helpful as well. There are other more specialised services, you know, like the one we run here at St V's, for example, where for people who, you know, are down the track, we have a survivorship group that people are able to attend, which involves a bit of work around feeling more comfortable in your body and feeling more sort of connected to the idea that you're going to go on and be able to live your life, but also to knowing that, you know, there is this risk of recurrence at some point. You know, so there's quite a few groups like that which are springing up at the moment, and normally it would be or the people I find most helpful in terms of figuring out what's available are often the clinical nurse consultants, the triple Cs that work in the different sort of cancer fields, as well as the GPs.
Excellent. Thank you very much. I believe that Mr. Matthew Reid has a question. Matt, would you like to unmute yourself?
Yeah, thanks, Jack. I just want to thank Justin for the talk. You know, as a surgeon treating patients with cancer, you know, I learned a lot from your talk, so thank you. And I think just it's not a question, but just a comment. I just like the point that you made that it's okay for patients to feel how they want to feel. You know, you don't have to, if they're feeling down, you don't, you know, it's not all alarm bells. You don't have to try and change. Yeah.
Oh, look, I think, you know, absolutely that, you know, you are supposed to have moments where you feel aggrieved and distressed and despairing. You know, you're supposed to have moments where you're getting into bits of conflict with people. This is life-changing stuff. And, you know, when you meet people who really are sort of caught up in thinking to themselves, I have to be positive, have to be positive, have to be positive, it often makes everything so much worse.
Yeah, thank you.
Fantastic. Thank you so much. I'm now very excited to say that we have a member of our Possum community, Mr. Mark Kelly, from a cancer patient to cancer survivor, and he's going to discuss with us today his experiences and the challenges he's faced in his recovery and how he overcame them. Let's welcome Mark.
Morning, everyone. Jacinta, you can hear me? Hopefully I've got it going.
Yep, we can hear you. Now we can't. I think you just muted.
Sorry, Mark, I think you've just muted yourself.
Unmute him.
Is that working, Jacinta?
Yeah, it's good.
Is that working now?
I can hear you. That's good. I think it's working now. I can see and hear you.
Working, Jacinta? Okay, thank you. Sorry about that. Just like to thank all the speakers so far. Very informative and very interesting. Just to start off about myself, 56-year-old from New Zealand, been in Australia for 7 years now. General manager of a meat processing plant, employing 1,200 people. And been in Melbourne the last 5 years. Generally fit. I like to do a bit of running, half marathon, Summit Survivors. Also did the Tough Mudder a couple of years ago, so very good on that. And just mention the medical team: Michael He, surgeon, Melissa Moore, oncologist, Georgina Baker, gastroenterologist. I think I got that right. And Paul Burke as my GP. So first diagnosis, went to Paul on 12th of May, just with a bit of pain in my chest, top of my stomach, and he moved things pretty fast. 2 days later, I seen Georgina Baker, and 4 days later, got diagnosed with cancer, and on the same day had Michael He call me and put a plan in place in 3 stages. So all within a week, it was all happening. So confirmed stomach cancer, obviously it required chemo, operation and more chemo. So started my chemo on the 10th of June, had 4 cycles, That finished the end of July. 2nd of September, had my operation, which was a full stomach removal. 3 days after the operation, I was on no pain medication whatsoever, and had all my drains and drips all removed on day 4. During the time, after 4 hours from the operation, the nursing staff had me up out of bed, sitting down, which I was amazed at. It was incredible. And obviously walking from the next day onwards. By day 5, I actually weren't doing laps around the ward, I was actually doing steps, and then I was counting kilometres on my watch, and managed to get up to 5 kilometres before I left hospital, which was on day 7. So excellent care in the hospital, very well done, and just kept going. So exercise is a big part of probably prior to the operation I did, during my stay in hospital and afterwards. So I was averaging 10 Ks a day walking, got up to 15 Ks, 20 Ks prior to the operation, and also did quite a bit of Bikram hot yoga as well, 2 to 3 times a week, just to keep me moving and motivation. My eating, and obviously it was a big change. Always a meat and 2 veggies, especially from my meat works, plenty of steak and a lot of barbecues. Really enjoyed it, so it was a big change of what I'm going to, and I thought, what am I going to do with all the meat in the freezer? So eventually I am getting through it. It's getting cooked in a slow cooker instead of a barbecue, but it is getting used. Now I'm eating, you know, just about everything I used to eat, but obviously cooking a bit more, chewing a lot more, and really looking forward to doing a lot. I have learned how to cook a lot more and not just on a barbecue. Some big changes and challenges there. One of the biggest things that has really helped me is the support. Right from day 1, first question I asked Michael was, when do I tell my family, when's the best time? Michael's advice, and I still remember this, is there's no right time, it's when you feel, but the answer will still be the same, whether it's day 1, next week, or next month. So I made the decision, all my family's in New Zealand, so I rang them Skype, talked to my 2 children, my mother, brothers and sisters, all at the same time. One of the hardest things I've had to do, but from day 2 onwards is probably the most rewarding and easing, because as out of my system, everyone knew what I was going through, and obviously the support I had from them was tremendous. Obviously COVID, no one could travel from New Zealand, and they still haven't. Some want to come over prior to Christmas, but I've said no, I want to wait till after Christmas. So a few talks going through on the weekend now, planes are open from New Zealand. Another good friend of mine in New Zealand who I hadn't seen for a number of years, really good support, Tracy. She's every day, every night we're talking, really good communication, and I bounce a lot of things off her, and she returns that, and we enjoy that going. Neighbours, got a street group on Facebook, very supportive. They actually cook my meals quite often, so I get 2 to 3 meals a week cooked for me and just dropped off at my doorstep, which is really good. They've asked just about what I want now, so it's even getting better, so really good there. And just for anything shopping, they'll always offer to help as well, and just talking. One of the other ones which has really helped a lot is work. Tremendous support, ongoing communication and meetings I have, and it's keeping me involved day to day. It's kept me mentally fit, it's busy, you know, motivational, and it keeps the mind very active. Throughout this journey, as it continues, I'm working from home. I did take 3 weeks off after the operation, and that's the only time I've had off work. So it continues carrying on where we are, and it's great support. I'm at stage 3 now, going through another lot of chemo. I've had 2 cycles. I'll go for my 3rd lot this Wednesday. After my 4th one, I'll have more scans, and hopefully that's the end of my chemo, but yet to be seen. So total journey for me has been 7 months up until Christmas time, and I hope to be back at work on site in January, doing what I normally do, and carrying on from there. But for me, I'll always be grateful for such an excellent medical team. It's really helped me support and given me a lot of confidence. They've made this a success for me, and they continue to give support. I'll just say to everyone, they're only a phone call away. I can ring, Michael's rung me, Skype meetings with Melissa just about every fortnight, and continue emails and support. Nothing's too big of an ask or a challenge. So obviously I'd recommend anyone, they're your biggest support team. They've got the answers when you're not sure. Michael and his team, I'd never thank enough, what I went through and how I come out of it. If someone said to me, I'd be up out of bed after 4 hours from the operation, sitting down, I'd be home within 7 days. Michael actually said I can go home in 6 days, but I wanted to speak to the nutritionist a bit more and find out a bit more. So I did an extra day in hospital, which was well recommended. And, where to from here? I'm not changing, I'm still challenging myself. I've set some goals to myself as well, and I'll continue to do that. One of my challenges and goals I will be doing next year is I'm going to get fit again and start jogging and do a half marathon in Melbourne. Really enjoyed that. And, I'd like to challenge, Jacinta and her team and St Vincent's and, join me in the half marathon next year. I think it's a well cause that we can raise some money for. And, I look forward to getting everyone on board with that. But that's about my experience, what I've gone through. Very happy with the outcome, and continue to progress forward. And I'm looking forward to the next sort of month to 6 weeks, and then just carry on generally with life in general. Thank you.
Mark, thank you so very much. It was absolutely wonderful to hear you chat today. On behalf of myself, I'm also going to speak for some of my team here at Challenge Accepted. I believe that Matt has raised his hand. Matt, would you like to say something?
Yeah, thanks, Jack, again. Thanks for sharing your story with us, Mark. It was a amazing journey you've been through. My question is, over that whole journey, what was the hardest part for you? Was it like the diagnosis or the treatment or the recovery, or sort of where you are now?
Mark, the hardest part for me would have been the diagnosis, that first call from Georgina, and saying you have got cancer. There's no easy way of saying it. And then it was the unknown, probably until I spoke to Michael that afternoon, and getting through that stage and telling your family. It's never an easy time. And it's going to be emotional when I do get back to New Zealand and meet my family. I'm planning on a holiday next year when flights open up. But that's probably the hardest for me and myself.
Yeah, thanks for sharing.
Thank you so much, Mark, again for speaking. We really greatly appreciate it. We're going to move on to our next speaker now. It was reported that one of the key findings from the Victorian Comprehensive Cancer Centre Patient Survey, receiving care from a specialist cancer nurse is the most consistent factor in patients saying their treatment experience was a good one. It can often be overwhelming having many different appointments and trying to retain a lot of new information. I would like to introduce our Cancer Nurse Coordinator, Ms. Paula Swannock, and she will discuss with us her role. Got it. Sorry, everyone. You got it then? You just need to turn it off completely. And she will discuss with us her role in the unit, so please make sure you're familiar with Paula's face and don't forget her details. Thank you.
Thank you. Can you all hear me okay? I've got this headset on, so is that okay? Great. So yeah, I just wanted to introduce myself. My name's Paula Swanwick. I'm the new Cancer Nurse Coordinator for St Vincent's. I've been here roughly for 2 months now. So I just wanted today to talk about an overview about my position and what to expect from the Cancer Nurse Coordinator. So it's interesting listening to Mark and Justin about the diagnosis of cancer and what happens after then. So my role is to really support these people from that first diagnosis. And I think the overview of the Cancer Nurse Coordinator is really to support, advocate, educate, and navigate care for patients. So even from that initial consultation, I think there's so much information that you're taking in that you don't remember all the stuff that's been given to you and all that information. So I'm that person at the end of the phone to ring the next day and go, actually, what did they say about this? And I encourage people to write down a list of their questions about the consult so we can go through it afterwards. So that's definitely one part of the role, especially as well, like they were saying with the surgery, these surgeries are complex and scary for people as well. So it's that added support about what to expect from the surgery and what to expect afterwards as well. And also to navigate patients and people through their care along the different specialities. So whether it is going into the surgery or to oncology, I'm that constant support there throughout that journey. As well as planning for the recovery as well after surgery. So even though that build up to the surgery can be quite daunting, it's you know, like they said, it's what's going to happen afterwards. So it's helping to educate, and I think when people are more educated and they know what to expect, it can really help them when they're processing all the information and transitioning through that different part of their journey as well. So as well, I'm that advocate here at the hospital for people to make sure that they're going along the right pathway, they're getting their follow-up appointments, getting their first consultations. At the end of the phone to ring up and go, look, I'm not feeling very well, this is what's happening, and I can liaise with the consultants here at the hospital for them as well and advocate any woes that they might have as well. So I've just been here for 2 months, so these are the things that I'm processly involved in, as well as looking at where we can expand this service as well. So it's definitely listening to the patients, the people, the family, what they expect from the service and what they would like to be included. And I'm looking at setting up a clinic, a nurse-led clinic for patients for after their diagnosis, and to give them education regarding their surgery and help them with their enhanced recovery afterwards, as well as a possible link there for after the surgery. So whilst people are waiting for their consult with the consultants, as a brief moment for me to see them and have a bit of a rundown about how you're feeling, what's going well, what's not going too well, to see if it can flag up any early issues while you're waiting as well. So yeah, this was just really, I know I've only got 5 minutes. This was really just a brief introduction to myself and to put my name up there and how to contact me. And yeah, that's pretty much the Cancer Nurse Coordinator in a very brief nutshell that in the time that I had. So yeah, any questions, that would be great.
Thank you so much, Paula, for making the time to chat with us this morning. We are now going to be moving on to a quick quiz, so I hope that everyone has been paying attention. The quiz is going to involve a couple of prizes, so these will include $20 supermarket vouchers and some environmentally friendly wax wraps. So the way that this will work is I will ask the question, and then there'll be 3 possible answers which I will also read out to you. You will press stop or type stop in the chat box, and the first person who types stop, I will then ask you to write down in the chat box your question, and then we'll confirm if that was correct. If the answer isn't correct, we'll open the question up again to the group. So just to repeat that, I will ask the question and 3 possible answers. If you think you know the answer, please type stop in the chat box, and then I'll get you to write the answer in the chat box. Okay, so question number 1 for a $20 Woolworth voucher. Here we go. And a wax wrap. The question, as you can see, is just coming up on screen as well. Which food contains the most protein? A, meat, seafood and dairy. B, fruit and vegetables. Or C, bread and cereals. If you think you know the answer, please write stop in the chat box. Again, repeating the question, which food contain the most protein? A, meat, seafood and dairy. B, fruit and vegetables. Or C, bread and cereals. If you're not sure how to type in the chat box, please give me a wave or we can unmute you. Oh, stop. Okay, excellent. Thank you, Mark. Mark, would you please like to write your answer in the chat box? A, that is correct. The foods which contain the most protein are A, meat, seafood and dairy. Okay, question number 2, again for a Woolworths voucher and a wax wrap. If you have had surgery to remove part of your gastrointestinal tract, you may A, struggle to eat larger portions, B, be at high risk of micronutrient deficiencies, or C, both A and B. If you think you know the answer, please type stop in the chat box or give me a wave. I can't see. Any waves? Oh, Lorraine, is that a wave, Lorraine? Excellent. Now, Lorraine, I'm just going to unmute you. Ask to unmute.
Unmute. So I'll just put my answer.
Yeah, would you like to tell us your answer?
C.
Correct, Lorraine, that is correct. Excellent, fantastic. Now, question number 3. Again, for a Woolworths voucher and a wax wrap. If you have had surgery to remove part of your gastrointestinal tract, you should ask your GP to do a micronutrient screen. A, every 6 to 12 weeks, B, every 6 to 12 months, or C, every 6 to 12 years. Again, if you think you know the answers, writing stop in the chat box or giving me a wave. I'm looking for some waves. Does anyone think they know the answer to this question? Oh, stop, Mark. Mark, you're on fire today. Mark, would you like to please write the letter for your answer in the chat box? B, that is correct. Thank you, Mark. Excellent. We will move on to question number 4. Another Woolworths voucher and a wax wrap. As you can see, it is written on screen. I will read it out, but if you think you know the answer straight away, feel free to write stop. Exercise has been shown to be beneficial for people with cancer. Which of the following can improve with exercise? A, cancer-related fatigue. B, physical fitness. C, anxiety and depression. Or D, all of the above. If you think you know the answer, write stop or give us a wave. Oh, Lorraine again. Lorraine, would you like to unmute yourself and call out your answer, please?
D.
Correct, Lorraine. Fantastic. Excellent. Now moving on to question number 5. Again, calling out or giving me a wave if you think you know the answer. Which of the following is false about exercise for people with cancer? A combination of aerobic and resistance exercise is recommended. B, exercise support for people with cancer can be provided by AEPs. Now there are accredited exercise physicians and physiotherapists. C, even doing a few minutes of exercise is better than doing nothing at all. Or D, it is not safe to exercise whilst undergoing cancer treatment. We've got to stop from Mark there. Does anyone else think they might know the answer? I We'll just give ourselves a minute to see if anyone else wants to put their hand up. I wonder, Peter Moran, if you think you might know the answer to this one. I think you do. Let's give Peter a shot. Peter, would you like to unmute yourself?
I think D.
Oh, congratulations, Peter.
Yep.
Excellent. That is the correct answer. Thank you.
Okay.
Now, moving on to our last question. Now, I hope that you've been paying attention for this one. For a $20 Coles voucher and wax wrap, what is Paula, our cancer nurse coordinator's mobile phone number? Perfect. Does anyone think they know the answer? Come on, Ann Nichols, I know you're out there paying attention. Does anyone else think they know? Matt Reed thinks this is a tough question. I wonder if he knows the answer to this one. Does anyone want to take a guess? Have we got no bidders? Oh, I might have to call someone out again. How about I'm going to ask Michael He and see if he knows the answer to this question. Michael, can you unmute yourself?
That's a tough question, Jacinta. I'm not sure if Paula even knows the answer to that question.
Which one do you think it might be, Michael?
I'm going to go with A.
A. Unfortunately, I was hoping that Michael would give us the wrong answer, but as always, he's pulled through with the correct one. A is correct. Excellent. Well, thank you everyone for attending that quiz. It's always good to have a little bit of fun despite the fact that we can't see each other face to face. So we are coming to the end of our session today. So I'd just like to thank all of the speakers for taking their time this morning, and thank you all for your questions and participation. If you have any personal questions for members of our team, we encourage you to contact our nurse Paula to book in for further discussions. Now, just as a friendly reminder, Paula's number is answer number A there. So that's 0428 118 658. So please contact Paula if you have any further questions. Now, in closing, a very big thank you to our speakers, Madeline Green, Kelsey Bland, Mr. Adrian Fox, Dr. Justin Dwyer, Ms. Paula Swanner, the Hepatobiliary and Upper GI teams, the nurses of 7 East. Shout out to Sue, who's made it on today as well. And together we're working tirelessly to improve patient services and provide our patients and their families with the best care. We'd also like to say a very big thank you to Mark Kelly for taking the time to tell us about his experiences today. Thank you, Mark. For any of you who've made donations today, we really greatly appreciate it. Each year, we are countlessly making improvements towards cancer research and improving patient outcomes, and none of this would be possible without the Surgeons Impact Fund. The Surgeons Impact Fund was set up by our surgeons to provide an independent, dedicated avenue to support activities which enhance patient outcomes within the areas of hepatobiliary and upper GI surgery. Their aim is to improve surgery, surgical outcomes, and improve post-surgery quality of life, and more than anything, to save lives. If you would like to donate to the Surgeons Impact Fund to contribute to our ongoing research activities, please visit our website or scan the QR code with your phone's camera. Each donation, no matter what the size, helps us to continue our fantastic work and is greatly appreciated. Lastly, a huge thank you to Lynn and Lily for adapting with the times to enable us to have an online virtual event. We thank you all again for coming on, for visiting and attending our virtual Possum event today. This event really could be not possible without your support, time and donations. And finally, I would like to hand the floor over to Michael.
Thanks, Jack. Can you hear me okay? So I'll just say a very brief thank you on behalf of the surgeons of our unit, and also Simon Banting, who's our head of unit but is operating today. So first of all, of course, thank you very much to you, Jacinta, for a great job emceeing today. And I really want to thank Lynn and Lillian, who run our research team, but they really put in hours and hours of work organising this event. And when it's online or when it's in real life, it really runs very smoothly every time. So thank you very much, guys. It's really wonderful. Again, thanks to the speakers, really great informative speakers today. It's the first time I've had Justin Dwyer speaking, and I learned a lot today, so hopefully we'll get him along next year again for some further advice. I think, you know, it's been challenging this year, isn't it, adapting to online learning and online consulting, and I think this was a great version of the Possum event, but hopefully next year we can have everyone back in the same room. For us as surgeons, it's really wonderful seeing our old patients and our old friends, and sort of seeing them get through and on with life after cancer and after surgery and all that sort of stuff. Having people together and having that time afterwards to kind of meet and bond really makes the day much more special. So hopefully we can return to that next year. So I really hope you all found it useful, and I'd like to thank all of our old friends for coming along and joining us today. Thanks to the team. Looking forward to catching up with you all in the future. Thanks, everyone.